How are you doing, my guys? How are you doing, my YouTube family, guys? I said today I must put a video for my people, and today is a special one, guys, because I'm gonna give you all the tips on how to answer prioritization questions, and afterwards we are going to review together 10 questions, and you are gonna comment in the comment section below about your score. Tell us, I've scored 10 out of 10, and we say, man, congratulations, you made it. And then you comment 7 out of 10, and we say, good trial. And then you comment 2 out of 10, and then we say, you need to apply more effort. So guys, welcome to this channel. This is Nursing Embassy, and my name is Bosco. I'm a professional NCLEX reviewer based here in Africa. Please welcome and remember to subscribe. Let's go straight away into our review. So guys, let us attempt to explore the 10 tips on how to answer prioritization questions. Guys, the first tip is attend to the acute patient first and leave that one who is chronic. Okay, so the second tip is that you should prioritize the unstable and leave the stable patient first. If you see any question where they have put a patient with signs and symptoms that show the patient is unstable, prioritize that patient. Then guys, leave or do not prioritize the patient with the expected signs and symptoms of that disease. So if you see the patient, however much the signs and symptoms look alarming, but they are expected, for example, a patient with COPD with SpO2 which is low, maybe 92%, that is a patient with unexpected sign and symptom of that disease. Leave that patient alone and look at other options and see what options have they given for you to choose from other than that one. Option number 4, use the nursing process. And when you use the nursing process, guys, remember that assessment comes before implementation. Always assess your patient first before you do anything to help them. Strategy number 5 is use ABCs. Guys, always remember that the patient's airway is a priority. Unless we are doing resuscitation and the patient has no pulse, that's when the circulation comes first. Otherwise, airway, breathing, circulation is the strategy. Strategy number 6, use Maslow's hierarchy of needs. Maslow's hierarchy of needs outlines physiological needs as priority. So guys, before you attend to any other needs of the patient like psychosocial, remember that physiological needs must be prioritized. Strategy number 7, give extra attention to the word new when it is used in a sentence. Like, for example, patient has been okay but now has developed new S3 sound. That means that option, look at it very keenly and compare it very well with other options that have been given. Most likely that is the answer. Okay, strategy number 8, guys, the fresh post-op is a priority. Fresh post-op compared to other med-surg cases is a priority. When they mention a patient below 12 hours from theater, always take extra attention. There could be an answer there. Strategy number 9. Patient safety is a priority. For example, patient has a seizure, patient has been having seizures, and then they ask you what action do you prioritize? Administer medications, raise the bed rails. Okay, you know that raising bed rails is a safety precaution and you need to take extra caution there. That could be the answer. Okay, then guys, the last strategy is stress strategy number 10. Select the option with a lab value that kills faster. Guys, if they have mentioned a lab value within the option, look at if the options are all about lab values. Maybe they have given you hemoglobin, maybe they have given you potassium, and they have given you blood glucose. Look at, weigh all these options and see which lab value should I consider mostly, because if I do not intervene, this patient is going to die faster, and select that option. And guys, generally, like I always tell you, with prioritization questions, look at what makes the patient die faster. If you did nothing, if you did not intervene, what makes that patient die faster? And that is how you are going to get all these answers on prioritization questions. Thank you guys. Now let's go and see some keywords that are normally used with prioritization questions. So guys, first of all, let us explore the keywords that are normally used in prioritization questions. Yes, in prioritization questions, the way you will see that this is a prioritization questions is when such words have been used. For instance, best, first, what is the initial action? What is the chief complaint that will provoke the nurse to assess the patient first? Most, safety, priority. All these are keywords that will tell you this is a prioritization question. Alright guys, let's go for our review. Question 1. The nurse has received a report on all the 4 assigned patients. Which patient should the nurse assess first? Option A. Client with dehydration with blood urea nitrogen of 24 milligrams per deciliter. Okay, client who is come in bed with potassium of 7. Client with myelodysplastic syndrome with WBC count of 2000. Client with sickle cell disease with hemoglobin of 7.9. Guys, what is your answer here? These are different patients with different lab values. What is your answer? Write your answer down. We are going to find out. Okay guys, the answer is B, and the principle that we have used is we have selected the patient, we have prioritized the patient with the lab value that kills faster. The patient with hyperkalemia will die faster if care is delayed, because this patient is on high risk of getting dysrhythmias. Okay, we know that our patient has a BUN of 24, and that is the normal range. Our patient's BUN is slightly elevated but will not kill the patient immediately, so we don't prioritize that one. WBC count in the normal range is that one. Our patient has low WBC count of 2000, but that will also not kill the patient faster, and moreover, patients with myelodysplastic syndrome usually have low WBC count, and so that's an expected sign and symptom. The patient also, this patient with a hemoglobin count of 7.9 is not an emergency. Really, we can always consider it to be this patient to be fit for transfusion when they reach hemoglobin 7, so we can borrow more time here, but we cannot borrow time on a patient who is having potassium of 7, because that patient will have dysrhythmias anytime. Alright guys, let's go to the second question. A client A client's telemetry monitor displays ventricular tachycardia. Upon reaching the client's bedside, which action should the nurse take first? Okay, guys, the options that have been given are call a code, prepare for cardioversion, prepare to defibrillate the client, check the client's level of consciousness. Okay, guys, what is your answer? Because we are going to discover the answer very shortly. Okay. Yes, the answer is D, and the principle used is the nursing process. Assessment comes before implementation. So guys, assessing for unresponsiveness helps determine whether the client is affected by the decreased cardiac output, and if the client is unconscious, then CPR is initiated. Alright guys, question number 3. A nurse has been assigned the following 4 clients. Which one is priority? Client taking labetalol with a pulse of 54 per minute and blood pressure of 155/86. Client with pneumonia who has been on IV fluids and now has a new S3 sound. Client with chronic obstructive disease with an oxygen saturation of 92%. A client whose large toe was amputated complaining of severe pain of 8/10. Yes, write down your answer and we'll see whether what you have written down is the answer. Which client are you going to prioritize here? Yes, the answer is B. Yes, so the principle we have used in selecting the right answer is choosing the option where patient has new symptoms. A new S3 sound in adults is an abnormal finding. Okay, so that means that the patient's valves are not working as expected and the patient is having regurgitation. So what about the other options? Like in option A, a pulse of 54 per minute is expected for a patient who is on labetalol, which is a beta blocker. Remember, beta blockers, like the name suggests, they block the beta receptors, they block the receptors for sympathetic action, so that will lead to a lowered pulse rate that is expected in a patient on labetalol. And then an SpO2 of 92% in a client with COPD is also expected. Actually, for COPD patients, we should have some level of carbon dioxide within their system because the stimulus for their breathing is no longer oxygen but carbon dioxide saturation. Then the client with severe pain should be helped, but not before assessing the client with the new S3 sound. Guys, yes, they will bring patients with severe pain to scare you a bit, but remember that pain is not going to kill the patient immediately. Alright guys, let's go to the next question. Alright, question 4. The nurse receives the handoff shift report on assigned clients. Which information is most concerning and prompts the nurse to assess the patient first? Client admitted 2 hours ago with gastroenteritis who has been vomiting for 36 hours and has muscle cramps and weakness. Client 1 day post-colon resection who is receiving continuous epidural morphine and reports severe itching. Client who is receiving IV bumetadine for 3 days for heart failure and experiences dizziness when standing up. Client with acute post-streptococcal glomerulonephritis with gross hematuria who is on antibiotics. Which patient, guys, are you going to prioritize first? Alright, so write your answer down as we discover which is the correct answer. Yes, the answer is A, and the principle we have used is that we attend to the most acute patient first. Okay, these other options, a histamine-related reaction is unexpected finding in the client receiving epidural morphine. An antihistamine may be prescribed. to alleviate the itching. And for the patient on bumetadine, which is a diuretic, sometimes these patients get excessive diuresis. The client may experience orthostatic hypotension, and the nurse will keep monitoring this patient for symptoms of hypokalemia. Yes, then the patient with gross hematuria, that is an expected finding in acute streptococcal glomerulonephritis. Moreover, patient is already being cared for with antibiotics, so no need to worry. Alright, let's go for the next question. Question 5. The nurse in the prenatal clinic is monitoring a client who is pregnant with twins. The nurse monitors the client closely for which priority complication that is associated with a twin pregnancy. So whatever they are going to give us are complications, but they are looking for the most serious complication. So which is the most serious complication here? Hemorrhoids, post-term labor, maternal anemia, costovertebral angle tenderness. Okay guys, what is your answer? Write down your answer. We are on question 5, guys. Alright, the answer is C, and the principle used is that generally ask yourself what will kill the patient faster. Alright, maternal anemia often occurs in twin pregnancies because of a greater demand for iron by the fetuses. Option 1 and 4 occur in a twin pregnancy but would not be as high a priority as anemia. And option 2 is incorrect because twin pregnancies often end in prematurity, not post-datism or post-term labor. Alright guys, question 6. Alright guys, we are already in the middle of the video, and if you feel what I'm doing is good, please, and I'm requesting, please make sure that you subscribe to this channel so that you get more videos like this to help you pass your exam. Question 6. On assessing a client who has had coronary artery bypass grafting, the nurse finds the following vital signs. Okay, the temperature is 37.8, pulse is 110, BP is 96/60, and respirations are 20. The patient also has distended neck veins, muffled heart sounds, and based on this assessment data, which is the priority nursing action? Increase frequency of client monitoring, ask the client about pain, report findings immediately to the physician, call the lab to draw blood cultures. So, which option would you choose here, guys? Write your answer down. The answer is C. Okay, the principle used here is that we are looking at patient safety first. That's why we have chosen answer as C. So guys, the client is displaying signs and symptoms of cardiac tamponade, which is a medical emergency. The accumulation of fluid within the pericardial sac, guys, is very dangerous because it can lead to ineffective contractions and lead to lowered cardiac output, and that can lead to ineffective supply of blood to vital organs like the brain, which will lead to the patient dying faster. So guys, what about these other options? Increased monitoring will occur, but calling the physician is the priority. Pain may cause tachycardia, but it wouldn't cause jugular venous distension. Lab cultures are usually not done until the temperature is 102 or above. Okay guys, so let's go to the next question. Question 7. A nurse is reviewing the plan of care for a pregnant client with a diagnosis of sickle cell anemia. Which nursing diagnosis, if stated on the plan of care, would the nurse select as receiving the highest priority? Okay, so we have been given options including anxiety, ineffective coping, disturbed body image, and deficient fluid volume. What is your answer, guys? Just pause the video and write down your answer. Okay, the answer is D. The principle used here, guys, is that we have used Maslow's hierarchy of needs theory to prioritize, remembering that physiological needs come first. So using this guideline will direct you to option 4. Deficient fluid volume is a physiological need and is the priority nursing diagnosis. Let's go to the next question. Question 8. The client with the diagnosis of cancer is receiving a morphine sulfate 10 milligrams subcutaneously every 3 to 4 hours for pain. When preparing the plan of care for the client, the nurse includes which priority action? Monitoring stools, monitor the urine output, encourage the client to cough and deep breathe, encourage fluid intake. Okay, pause the video and write down your answer. What is your answer, guys? The answer is C, and the principle used, guys, is that we have used the ABCs, airway, breathing, and circulation, as a guide to direct you to the correct option. Recall that morphine sulfate suppresses the cough reflex and the respiratory reflex. Although options 1, 2, and 4 are components of the plan of care, the correct option addresses airway. Remember, use the ABCs, airway, breathing, and circulation to prioritize patients. Alright, guys, question 9. We are almost there. The nurse in the newborn nursery has just received a report. Which of the following infants should the nurse see first? Okay, we have the following infants. A 2-day-old infant who is lying quietly alert with a heart rate of 185. A 1-day-old infant who is crying and has a bulging anterior fontanelle. A 12-hour-old infant who is being held with respirations that are 45 breaths per minute and irregular. A 5-hour-old infant who is sleeping and whose hands and feet are blue bilaterally. Okay, guys, pause the video and write down your answer. Yes, the answer is A, and the principle used is ABCs. Baby is in here. We are going to use circulation as a priority, and this baby is in a tachycardic state. The newborn with bulging fontanelles when crying, and a newborn having blue extremities for the initial hours after birth, which we call peripheral cyanosis, is unexpected finding, and a respiratory rate of 45 is a normal finding in a newborn, whereby we expect the respiratory rate to be around 30 to 60, so 45 is no issue to cause any alarm. However, the patient who is having tachycardia should be prioritized because very soon cardiac output will not be sufficient to supply vital organs. Okay, guys, the last question. Thank you for being around up to this time. Thank you for reviewing together with me. Let's do this last question together. Which information obtained when taking a client's health history will be most important in determining whether the client should receive the human papilloma virus HPV immunization? So all the following we are given are factors that are to be considered when giving this patient this vaccine, but which is the most important? Okay, so which consideration is the most important? They have given us, guys, client who is 19 years old, client is 19 years old, client is sexually active, client has a positive pregnancy test result, client has tested positive for HPV previously. So guys, which factor here would you take as priority when considering whether to give this patient this vaccine or not? Okay, write down your answer. Yes, the answer is C. And what is the principle used here, guys? Yes, comment down here in the comment section so that I can see what you considered. If you got the answer right, what did you consider as the principle? Which principle guided you? Okay, so according to CDC guidelines, HPV immunization should not be given during pregnancy. However, ideally the immunization series should start at age 11 or 12 years for girls and boys, but it may be started up through age 26 years. HPV immunization is most effective in preventing HPV infection and cervical cancer when it is started before the individual is sexually active and before any HPV infection. But these are not contraindications for vaccination. I acknowledge the following resources for helping me come up with this video. You can contact them, you can use them, you can buy them so that they can help you in passing your exam. If you are still around up to this time and you are still watching, I really want to appreciate you. Thank you so much for supporting my channel. Thank you for subscribing, those of you who have subscribed. And please, if you feel this video was helpful, remember to share it with your friends and recommending this channel to them so that we can work together to pass this exam. Thank you guys for being around. Until next time, bye bye for now.